Imagine waking up one day to find your body turning against you. Your periods become unpredictable, hair starts growing in unwanted places, and no matter what you do, the scale won't budge. This isn't a nightmare. It's the reality for millions of women with PCOS. In the next few minutes, we're going to take you on a journey inside the female body to show you exactly how polycystic ovary syndrome develops and why it causes such widespread chaos. By the end of this video, you'll understand PCOS like never before. In a normal menstrual cycle, hormones work in harmony. The hypothalamus releases gonadotropin-releasing hormone, which signals the pituitary gland to produce follicle-stimulating hormone, also called FSH, and luteinizing hormone, also known as LH. These, in turn, regulate the ovary's production of estrogen and progesterone, and ovulation happens. It's a finely tuned system. If hormone levels were dramatically out of sync, with luteinizing hormone levels disproportionately high compared to follicle-stimulating hormone, leading to a surge in androgen production from ovaries. During PCOS insulin levels, research has shown that insulin resistance plays a significant role, creating a vicious cycle. As cells become less responsive to insulin, the body produces more, inadvertently stimulating the ovaries to produce even more androgens. This insulin resistance can occur regardless of a woman's weight, though it's often linked to obesity. The irregular periods, the stubborn weight gain, the acne that may persist well beyond teenage years. But how did these hormonal imbalances lead to such widespread effects? As the excess androgens will not only disrupt menstrual cycle but also stimulate sebaceous glands, leading to acne and excessive hair growth, especially on face. The insulin resistance will make it difficult to lose weight and put you on increased risk for type 2 diabetes and cardiovascular issues. The lack of regular ovulation means the body is exposed to unopposed estrogen, potentially increasing risk of endometrial cancer. It was a domino effect, with each hormonal imbalance triggering a cascade of consequences throughout your body. There can be a pattern of irregularity in periods that had persisted since during teenage years. Irregular periods, defined as fewer than 9 periods a year or cycles more than 35 days apart, are a classic symptom. But there is more struggling with persistent acne and unwanted hair growth on face and body. It becomes increasingly difficult to maintain a healthy weight despite best efforts. These symptoms are all interconnected, part of the complex syndrome known as PCOS. The excess androgen levels could lead to hirsutism, affecting about 60% of women with the condition, while acne was present in around 20% of cases. Weight gain, another common issue, was often linked to the insulin resistance frequently seen in PCOS. Yet, despite the prevalence of these symptoms, PCOS can often went undiagnosed or misdiagnosed for years. The average time to receive a PCOS diagnosis could be as long as 2 to 3 years after symptoms first appeared. This delay was often due to the variability of symptoms and their overlap with other conditions. The emotional toll of living with unexplained symptoms can cause frustration, anxiety, and even depression that many women with undiagnosed PCOS experienced. The physical symptoms, combined with potential fertility challenges, could significantly impact a woman's mental health and self-esteem. The Rotterdam criteria is the standard for diagnosing PCOS. A diagnosis requires the presence of at least 2 out of 3 key features: irregular ovulation, signs of excess androgens, either clinical signs like hirsutism or biochemical indicators from blood tests, and polycystic ovaries visible on ultrasound. PCOS is a complex condition. It's manageable with the right care. Certain lifestyle changes, particularly weight loss, can have a significant impact. Studies show that losing weight can restore ovulation in up to 80% of women with PCOS, with proper medications like combined hormonal birth control pills, anti-androgen drugs, metformin, and fertility drugs can help with treatment of PCOS. You can effectively manage PCOS and improve your quality of life.